Welcome back to the Healing Your DID course. I want to thank you for being a member to get access to this course. And in today's topic, we're going to be talking about trauma therapy. Trauma therapy heals. It is essentially your ability to be able to tackle the trauma that has caused you all sorts of psychological problems. Trauma in itself is the root cause of almost every single problem that people have within their life. If you heal that trauma, you will be greatly reducing the symptoms that you have with all sorts of disorders. However, many people do not wish to face their trauma. And that can be maybe because triggers are stopping them. So whenever they go to talk about the trauma that they have endured or issues that they have within their life, they would be triggered into a different personality state and they may not be able to discuss it. So it's very hard for them because they're not even able to discuss it. They may think that it's harder than it actually is. They may be overwhelmed with how much is going on that they feel as though their life is hopeless. And as a result, they won't seek the proper help that they need. Instead, they will just continue on with feeling hopeless instead of actually dealing with the problem. Sure, it's not easy, but you have to start somewhere. They may also be in a state of blissful ignorance, thinking that it's not all that big of a deal if they tackle it, that they don't want to tackle it. Like maybe they even have a sense of denial and dissociation there when they think, oh, everything is fine, nothing is going to be bad, or my life wasn't that bad, when they know deep down that it is actually very bad, very, very bad. So how do you heal triggers then? If you are triggered by some sort of memory or person or anything around you, what is the cause of that trigger? Is it the environment that you're in? A certain word that you hear even? Maybe it's the thought that goes through your mind. Even sensory, so such as smell, that can even trigger certain things. This is something that's very interesting because if you were abused when you were younger and there was a certain smell within the air, maybe it was of a candle, maybe it was of a certain food, maybe things along those lines that whenever you smell that thing again, you have flashbacks, the memories start coming back, and you begin to relive those as if it's happening now. You have to be able to work around the triggers. So if there's something that upsets you and there's something that is very triggering for you, you have to be able to navigate around it so that you can continue with your goal without it negatively affecting you as much as if you go right into it. You will eventually be able to go right into it via exposure therapy. This is one of the hardest things when it comes to healing triggers because you could be triggered into a different state. However, with enough time, you will be able to learn not to be as triggered by going through the process of healing some of these triggers. So with exposure therapy, what you're essentially doing then is you're being exposed to the things that cause you to be scared or cause you to be traumatized. And this can be very, very minor things even. Maybe it is going into a specific restaurant that maybe very, very bad things happen. So you avoid it at all costs. You avoid it for the longest time. That maybe you even are someone who just can't even drive past the place and you have a lot of things set up so that you can navigate around seeing this restaurant or this fast food place, wherever it is, because you do not want to go near it. Well, basically, one of the first steps you would take would be to learn to lessen some of the trauma associated with it, whether that be going to a therapist to help you deal with a lot of this to the point where you're able to start to drive by it and not be so scared, not be as upset. I mean, you may still feel it, but it's not going to bring as much negativity within you. After some time, maybe you are brave enough for you to be able to actually go into the place. Because the thing is, you're trying to rewire your brain to disconnect itself from those traumatic memories. You've formed a connection to this location, to this place that's causing you to be triggered in some sort of way. So how do you fix that? You have to retrain your mind so that when you go into this place, you're peaceful, you're happy, you're excited, and that you realize nothing bad's going to happen within here. That's what it's all about. You being able to go in there and realize, hey, I made all of this up within my mind thinking that it was going to be much worse than it actually was, but it's actually not all that bad. Nothing bad has happened here. I feel confident, I feel healthy, and I feel happy. And then with enough time of that, you have successfully retrained your mind. Triggers begin to expose the trauma. So if you are triggered by something, if something really upsets you and you don't know why, the moment you begin to really analyze that, it starts to bring back the memories of the trauma for you to be able to tackle. Next is lessening switching. So when you are triggered, another personality may come out. That is switching. You're switching into a different personality. And this is a defense mechanism. You switch into a different personality because whatever personality is out at the time cannot deal with the trauma, or there's certain words or phrases or things planted within your mind that whenever you see something, you react a certain way. So being able to recognize that and start to deal with some of those traumas will allow you to be able to heal. And you want to be able to lessen switching is to remedy the triggers. So once you're able to tackle the triggers, which is by tackling some of the deep-rooted trauma and by allowing yourself to realize that things are not as bad as you're making them out to be, a lot of the anxiety that we have, then you will switch much less into these different personalities. You can also check out my other course that I have, Overcoming Your Trauma course, which goes much more in depth specifically regarding healing trauma. That's going to be much more well-rounded when it comes to this whole trauma aspect. We can only cover a little bit in this topic. So if you would like more information about healing trauma specifically, be sure to check out my course on that. Coming up next, we're going to be talking about integration.